Hi everyone, welcome back to this short tutorial from ilovepharmacology. So let's learn about the sulfonylureas. So sulfonylureas are the oral hypoglycemic agents which are used in the treatment of diabetes mellitus. So what is the action of sulfonylureas? So basically when you give a sulfonylureas, they increase the insulin release from functioning beta cells. Please remember the beta cells has to have some functioning activity to sulfonylureas to act. So sulfonylureas will increase insulin release only whenever the beta cells are functioning. At least 20 to 30% of the cells should be functioning. So only in such case the sulfonylureas will release the insulin from the beta pancreatic cells. Thereby it produces the effect similar to that of the insulin. So if you have not seen the video of insulin, please go back to the video which has been done on insulin, how it acts, etc. So basically whenever the insulin is released, so it helps in the uptake of glucose into the cells and the muscles. Thereby it lowers the blood sugar levels. So we have under the sulfonylureas, the examples are gliclazide, tolbutamide, glipizide, we have glimepiride, we have glibenclamide. So these are the examples under sulfonylureas. So coming to the mechanism of action, how they are going to increase the insulin release from the functioning beta pancreatic cells. So sulfonylureas, they interact with the sulfonylurea receptor, which is the potassium ATP channel, which are present in the cell membrane of the beta cells. So by activating the sulfonylurea receptors, sulfonylureas will going to close the potassium channel. So thereby cell undergoes depolarization, and along with that they activate the voltage dependent calcium channels. Thereby the entry of calcium channels will stimulate the exocytosis of the insulin, means the insulin will be released into the circulation. So coming to the pharmacokinetic parameter of the sulfonylureas, so it is usually given through oral route. They bind extensively to the plasma proteins. When we talk about the half-life of the sulfonylureas, the glibenclamide has got the longest half-life of 10 hours, followed by glimepiride 5 hours, and tolbutamide and glipizide has got 4 hours each. So their action will be prolonged whenever the patient has got any renal dearrangement or renal disease, because they are excreted through renal route. So the uses of sulfonylureas, they are being an oral hypoglycemic agent. They are used in the treatment of type 2 diabetes mellitus, and it has shown to be effective in 30% of the patient. So one of the most common drawback of using sulfonylureas and what needs to be kept in mind is it is known to cause hypoglycemic episodes very frequently, and also it can cause weight gain as the side effect. So weight gain is the problem which you will encounter. So if you find this video useful, please do subscribe to your channel I Love Pharmacology. So this was a short class on sulfonylureas. Basically sulfonylureas will increase the insulin secretion by acting on the potassium ATP channel. They close the potassium channel, they make cell to undergo depolarization, and simultaneously they activate the calcium entry. There is a calcium stimulated exocytosis of the insulin. So one of the drawback of insulin which you need to keep in mind is it causes hypoglycemic episodes very frequently. Thank you.